Hello everyone, welcome back to another new video. So today's topic of discussion will be ESR, or also known as the erythrocyte sedimentation rate. So without any delay, let's get started. And also one thing to be mentioned that ESR is one of the most commonly examination that is prescribed by the doctors or the physicians in order to know about the various conditions of the body. So this topic is very much required for the physiological knowledge purposes and also for the practicing point of view. Starting with the definition, it has been mentioned that the erythrocyte sedimentation rate, or the ESR, is the rate at which the erythrocytes, that is the RBCs, settle down. Normally, the red blood cells, that is the RBCs, remain suspended uniformly in circulation, and since it remains uniformly in circulation, so this phenomenon or this process is called the suspension stability of the RBCs, because the RBCs needs to be have certain amount of stability or the suspension stability, otherwise it won't be in a normal physiological condition. Then if blood is mixed with an anticoagulant and allowed to stand on a vertical tube, the red cell settle down due to gravity with a supernatant layer of clear plasma. Now why so the anticoagulant? Because if the blood is coagulated, then definitely we won't be able to experience or find out the phenomenon of the settling down of the RBCs, which is the main aim. That is why we are using an anticoagulant. And it is also, let's consider this to be a test tube. Actually, it is not test tube. There are actually two tubes which we will be learning in the next slide. So in this tube, we are actually taking the certain amount of blood, that is RBCs, and we are letting this tube to stand alone for some time, and after a certain period of time the RBCs actually settle down, which gives us the value of the ESR. That is, the ESR settles down by the action of the gravity. It is due to gravitational action. And also beneath above this layer there is also a supernatant layer of clear plasma. Next, the determination of ESR. Now how to achieve this process, or how to find out the ESR value. So just as mentioned that we need a tube. So there are mainly two tubes, and the method is known by the name of the tube itself, the Westergren method and the Winthrop's method. Why Westergren method? Because the Westergren pipette or the tube is used, and so similarly the Winthrop's pipette or the Winthrop's tube is used. Next, let's study a bit about the Winthrop's and the Westergren's tube or pipette. So firstly, the Winthrop tube. The Winthrop tube is a short tube opened on only one end. It is 110 mm long with 3 mm bore. Winthrop tube is used for determining ESR and PCV, that is the erythrocyte sedimentation rate, and PCV meaning packed cell volume. I have already made detailed video regarding the packed cell volume, so if you want you can definitely check it out. And it is also marked on both the sides. On one side the marking is from 0 to 100, that is for ESR millimeter, and also from another side from 100 to 0 for the packed cell volume. And yes, it might be difficult to understand from this paragraph language. We will be understanding both with a detailed diagram in the upcoming slides. And the Westergren tube, the tube is 300 mm long and opened on both ends. It is marked 0 to 200 mm from above downwards, means from above it will start from 200 and 0. Westergren tube is used for determining only the ESR value. So here is the characteristic difference. One is 300 mm long, whereas one is 110 mm long, and another is that one is used for the measuring of both ESR and PCV, whereas the other, that is the Westergren tube, is used for the determination of the ESR only. So with the help of the diagram, we can easily identify which one is Westergren or which one is Winthrop's tube. So as mentioned in the previous slide, the Westergren tube, that is, it is opened on both ends. So if we see the diagram closely, this is the tube that is opened on both the ends. So it's Westergren's tube or the pipette, and also as mentioned that it is 300 mm long, that is the total length is 300 mm, and also it has marking of 0 to 200 mm from above downwards, so accordingly. And also the Winthrop's tube, as mentioned that it is used for determination of both ESR and PCV. So that is why we can see there are two. This one is for the ESR and another one for the packed cell volume, which is expressed in percentages, and it is opened on one side. So this one is the Westergreen's pipette or the tubes, and this one is the Winthrop's pipette or the tube. Next, coming to the normal values of ESR. Now, they again vary based on the method. If we use the Westergreen pipette or the tube, then the following results generally arises. That is, when we follow this Westergreen's pipette or the Westergreen method, in males it is generally found out to be 3 to 7 millimeter in 1 hour. In female, it is slightly more increased, that is 5 to 9 in 1 hour, and in infants, it is 0 to 2 in 1 hour. And again, similarly in Winthrop's tube, in males it is 0 to 9 in 1 hour. In female it is 0 to 15 in 1 hour, whereas in infants it is 0 to 5 in 1 hour. Now, coming to the variations of ESR. So, definitely there are both physiological and the pathological variation. Now, the physiological variation means the normal variations. Firstly, starting with the age. So, ESR is less in children and infants because of more number of RBC. Now, why the fact? Because if there are more number of RBC, then there will be more viscosity, as a result of which A won't be settling down more. That is why ESR is less in children and infants because of more number of RBCs. Next, the sex or the gender. It is more in females than in males because of less number of RBC. Again, just to the same fact, if the number of RBCs are less, so there is definitely less trafficking or less viscosity, and the RBC settles down more. So that is why the value is more in females. Menstruation, the same thing. The ESR increases during menstruation because of loss of blood and RBCs, the same explanation. And pregnancy, that is from 3rd month to parturition, ESR increases up to 35 in 1 hour because of hemodilution. So due to the hemodilution, that is again even further the decrease in the viscosity, less number of RBCs, as a result of which the ESR value rises tremendously. Again, now the pathological variation. That means the variations that we can see in certain conditions that are different from the normal physiological conditions. So, ESR increases in diseases such as the following condition. For example, tuberculosis, all types of anemia except sickle cell anemia. Because in sickle cell anemia, again, opposite explanation, there will be more number of viscosity and other factors. Malignant tumors, rheumatoid arthritis, rheumatic fever, liver diseases, and others. The ESR, again pathological variation, another type, the ESR decreases in the following conditions such as the allergic condition, sickle cell anemia, peptone shock, polycythemia, severe leukocytosis. Next, the factors affecting the ESR means what are the factors that are causing this ESR value to rise or to decrease. Firstly, the factors increasing the ESR. They are specific gravity of the ESR, Rolliolax formation, and the increase in size of the RBCs. Now, understanding it with a simple example. If the specific gravity is more, that means the relative density of the RBCs, if it is more, then definitely if it is heavier, then by the action of gravitational force, it will settle down more. So definitely the ESR value will rise. And so there's a Rolliolax formation. It is another special phenomenon of RBC and characteristic feature, that is Rolliolax formation means the RBCs when kept for a long time, they get stacked up in a pile, like a pile of coin, just like as I am drawing here. So as if they are stacked like a coin. So this is a special characteristic feature of the RBC for the formation of the Rolliolax formation, and for this reason also the ESR rises. And also increases size of RBCs. If the size of the RBCs is more, then definitely its mass is more, and if its mass is more, then its weight is more, then definitely by the action of gravitational force, it will settle more. Next, the factors again that decreases ESR. They are viscosity of the blood and low RBC formation. That is, if the viscosity of the blood is less, so definitely they won't be settling down, and if there is a less amount of friction and the viscosity, then definitely they won't be settling down easily. Instead, they will be they will be settling down, but not that much, like that in the above factors. And also, or not above factors, like in general condition, the amount of RBC that should fall will not be equal when the viscosity of the blood will be low. That means it will be in a relatively stable and a suspended state than in the normal condition. And also the low RBC formation. Again, same explanation. If the number of RBCs is less, then definitely the viscosity will be more. As a result of which, again, the ESR value will decrease. So, with this, we come to the end of today's video. We have discussed about the definition, the ranges, the various physiological and the pathological variations, and the factors that affects the ESR. So if you have any doubt regarding this video, do let me know down in the comment section below. And if you like this video, do press the like button and subscribe to my channel for more such contents. Thank you.